Welcome, everyone, to another episode of Business Talk, a podcast presented by Business West and sponsored by Greenfield Cooperative Bank. We have a great guest today. Our guest is Lois Nesci. She's the CEO of Gándara Mental Health Center. So glad to have you on the show today.
Well, Joe, thank you. And thank you for having me today. I'm thrilled to be here.
So I've written about Gándara a lot in the past, but kind of give our listeners a rundown of there's so much to it, but just kind of describe how you provide services to the community, and we'll get into some of the specific ones as we go.
Great. Well, maybe I can start by giving sort of a background of how we came to be.
That'd be great, yeah.
So we were founded back in 1977. In fact, next year we're celebrating our 50th anniversary, so we're really excited about that. So stay tuned. Maybe you'll have me back to talk about the 50th anniversary. So we started back in 77 at a time where there wasn't a lot of funding to support the needs of the community, particularly the Hispanic community and other marginalized populations. So we were able to start this organization with some small funding that we got. I think it was federally directed a grant to support behavioral health for the Hispanic community. So we started as a small behavioral health outpatient mental health clinic, actually on the campus of Mercy Hospital. Sister Mary Caritas, which many folks know, wonderful sister.
We know her well.
Know her well. She's actually going to be 103 years old in August.
It's amazing.
We just recorded a little video with her, so she's a wonderful woman. I've known her back since my years of working at Brightside in the 90s. But in fact, we started there. And so from there, we were able to continue to grow in these past 50 years to get support and funding from the community and from the state to really expand the services that we offer. So today we are providing services out of 70 different locations with 1,100 staff serving 18,000 people statewide. We're very fortunate to have this kind of presence and the ability to offer services. Sometimes, people ask me, how did you get your name? Where did the name Gándara come from? So here's my guess, even though I haven't read it anywhere, but this part I know. There was a prominent physician in Puerto Rico. His name was Dr. Jose Gándara Cartagena. And he was very prominent and influential in helping individuals overcome social determinants of care so that they can get good health care, good primary care. So he helped them eradicate issues like homelessness, unemployment, food insecurity, transportation. So then those things were a little bit more settled so they can get good health care. So my guess is that somebody back in the day when they were trying to name this organization said, who should we name it for? And somebody must have known of Dr. Gándara and said, let's name it Gándara.
As I said, I've written about this organization before, and I know you have multiple divisions of services. Can you tell me about some of them?
Sure. So our services are organized in ways that are very similar to each other. The programs are very similar. So behavioral health and substance use is a big area that we provide programs statewide. So we have actually in Springfield and Brockton, between both locations, 3 outpatient clinics where people can actually come to the office and get good mental health treatment as well as medication management. So a few years ago, we decided to invest on what's called TMS, transcranial magnetic stimulation.
I've heard of that.
And it was a tool. It's actually a chair. It's used for individuals who suffer depression, and some traditional ways of managing that depression or intervening with the depression haven't been successful because some tools work for some people and they may not work for others. Sure. Now, there are all kinds of rules with the TMS chair, and so we have to use it under the authority of a medical director, which we have, great medical director, Dr. Alex Altamarina. And so individuals come and sit in the chair, and there's this transcranial magnetic stuff that happens in their brain. And they have to come for a certain number of days, and it's overseen by people who are trained in that area. Substance use is a big need. More and more people are identifying as having that as a major issue or stressor in their lives. So you meet people where they're at. So in some ways, we're providing recovery coaching services to people in the community So people who are in recovery are assigned a recovery coach who can help them when they're stressing out or have a need or they're afraid that they're going to use again. They can call the recovery coach. We are also providing residential recovery services as a home to individuals who have come out of detox or maybe a CSS or TSS. These are more intensive levels of care for people who have substance use issues. But the homes are designed to help individuals who are getting ready to transition into the community to have a place to live, be able to secure employment, housing, and maintain their sobriety before they move back into the community. And in fact, we're opening our 8th home
Wow.
in South Hadley in the next couple of months.
That's fantastic.
Recovery centers, we have 7 statewide. In this area, we have 1 in Springfield and 1 in Holyoke. These centers are designed as places. The best way I can sort of, an analogy is like a drop-in center, okay? But people can come to it every day if they like, people who are in recovery. That way that they can get connected to resources. We offer them programs. The members of those programs are able to identify missing needs or gaps, and we have a way to create some programming around that. For instance, if they need support with how to manage their bank book or how to start a checking account or how to fill out an application for a job, how to get a driver's license, we will help them with those kinds of resources. But there are lots of services around substance use treatment. In fact, we're in some of the courts. And so there are judges who may say to individuals, rather than charge them and have them go to jail, they will say to them, you have to enroll in this service in order to avoid jail time, and you have to comply with it. So that's a big area for us, behavioral health and substance use. We also have behavioral health for children. We are the only community support agency focused on the Hispanic population in the Commonwealth. And we also, within that arena, we work with kids on what's called a community-based health initiative that Mass Health put together a number of years ago. And this is to provide behavioral health to children and families in their homes. And so this is a very unique way of helping children and families stay together if they're able to. And we have staff who are going into the home a couple of times a week providing behavioral health.
Oh, okay.
Coupled with the CSA, we're providing some coordination of services so that families can get their needs met and with other providers in the community. So those are a couple of big areas, big divisions that we have.
I get the impression, the word that keeps coming to mind when you tell me about all this is this continuum, that you're really meeting people along wherever their need might be. They're just kind of filling in some gaps and helping them sort of, get to a point of having a healthy, thriving life. Has it been a process over the years in building all of these different services of just kind of identifying where the needs are, where the gaps are, and kind of seeing what you need to provide to sort of make sure people have these services? Is it just kind of a constant assessment of what the needs are?
Yeah, the basic answer is yes. So we have our finger on the pulse. We know where the needs exist because some of the programs that we offer, we have the participants who are able to share with us what the missing service or program or need is. Yeah. We also work closely with our partners in the Commonwealth. Together, we're able to identify what else is needed. So we usually know where the need is, or there's input that is sought from us to provide input for the state. And they might put out some kind of request for a program that we apply for. And so we look at that all the time. We look at where is the need? Do we have the expertise to offer it? Where is it in the geographical area? And do we have the capacity? So for instance, I mentioned the program in South Hadley. So there is a big need for residential services for individuals coming out of detox to be able to transition back to the community. And we know that exists. Yeah. So we know there's an opportunity to open another home. Now, we also know that homelessness is a problem. There aren't enough homes and resources for individuals coming out of many of these programs. So even when they leave us, they may not always have a home to go to. Yeah. So under our prevention division, which we haven't talked about that one yet, That's a way that we're able to provide some housing. So we do some housing for adults, but also for young adults, because homelessness for young adults is very high. Within that prevention division, we have family resource centers. We have two, one up here on Main Street, and then we have one in Westfield. And these family resource centers, like the recovery centers, are like, I can describe them as drop-in centers. Families can come there. Same thing. They'll get connected to resources. They can identify what they need, and we will help them create programs around that to get their needs met. Some are getting food. Some are getting programs on how to read to their kids, work with their kids. But those are great places because we are able to help people get to the right place and see what they need.
You also have a division that specializes in intellectual and developmental disabilities?
Yes, Joe. We have a number of programs, residential programs for adults with intellectual developmental disabilities. Our homes maybe have about 3 or 4 adults in them. These are individuals who can no longer either live in their home or their parents are aging. And so this is a place where they can be with other individuals. Most times this is their home through end of life. And so if you came to some of our homes, they're very homey. They look like your home or my home, very comfortable. Their rooms are decorated with all the things they like. It's a very home-like environment.
Yeah.
So we also have what's called shared living. So some of the folks with intellectual developmental disabilities don't necessarily need to be in a residential home, but could be living with someone else. So shared living is like somebody like you and I would say, I'd like to have somebody live with me because I can help them, I can take care of them, and also they have a level of independence as well.
You're listening to Business Talk, a podcast presented by Business West and sponsored by Greenfield Cooperative Bank. We're speaking today with Lois Nesci. She's the CEO of Gándara Mental Health Center. Tell me a little bit about your background. I know you've got a long background in mental health services. Tell me a little bit about your career journey and how you wound up at Gándara.
Yeah, it's a long journey, Joe. I've been doing this for many decades. I'm always afraid to say how many decades. I say it to my staff, and then they all go do the math. How old is she? So I've been around a long time. But I started out young, working in residential treatment for kids, and I really loved it. I fell in love with it. I didn't think I'd love it this as much as I did. I did residential work. I was a clinician with these types of programs and so forth. And throughout my whole career, I've always worked in a setting where we provided residential treatment to children. In fact, at Gándara, we do have programs for kids who are in residential treatment, who need a break, need to learn some tools, and then be able to go to the best level of care or to return home or to their foster families. And in fact, we do some foster care too, as well. But anyway, so I started way back when doing that, and my work life has progressed in that way. And I've always worked in nonprofits, human service agencies, providing services to children, to families, to elders, people in substance use, and also to the Hispanic community. When I was working in Hartford at Catholic Charities, we had a program called L'Instituto por la Familia Hispana. And it was a specific program like Gándara, but smaller. And we had a variety of services provided for the Hispanic community. And so I always felt very tied to that and feel a kinship spirit with the Latino community for many reasons. One, for the amount of years I worked in that area. Also, I'm first generation Italian. My parents were born in Italy. I learned Italian before I learned English. And I saw the struggle they had with the language and the judgments that people made about their ability to command the English language very well. And so I know the judgment that came with that. And I believe that no one should be judged for how they look, how they dress, how they speak, their background, their religion, their sexual orientation. And oftentimes what's happened with the people that we serve, they're often judged in many ways. And I think we also have a responsibility to tell a different story.
You came on board at the beginning of 2020, which was a really interesting time to come on board anything. with the pandemic. Tell me about those early months. What a challenge that was in dealing with the shutdown and all of that.
Yeah. Well, first, let's say this. I hope I never have to relive that.
I think a lot of us feel that way.
Yeah, so I started with Gándara at the beginning of 2020. So I've been there a little over 6 years now. And so I will say this, wherever I would have been at the time, in some way I would have had to manage COVID.
Yeah, sure.
And we all did. So a month after I came on board, the state then declared the state of emergency. So we responded like everybody else did, in fact, and we had the ability to provide telehealth. Many of the people that we serve, our IT people, put that together very well. The state allowed it. And that worked out nicely because many people needed the service. They could not have been without the service. And so although they could not have come into the office or come into the office all the time, we were able to reach out to them. And many of the people that we serve also, this was their socialization.
Yeah.
Talk to people,
Sure.
especially if they live alone. So that was a nice way to be able to do it. So we had to address everything. For instance, how many people are at the office at a certain time and how we reached out to people in the community. We had to do the whole PPE, masked up. But we managed to continue. We continued well. We tried to work really hard to provide continuity of care. The staff had a lot of trouble staying home at the beginning. We put all these plans together, and the next day, everybody came to the office. It took about a week or two to get people used to this. Only 10 people in this office, 15 in that
Sure.
office. But we all managed it, and I'm glad it's in the rearview mirror. I will say that.
Definitely. One thing I wanted to that came to mind when we were talking about all the services you offer, and I've written about this before. There's the idea of stigma in mental health and people's willingness to seek help. Have you found that there's an evolution in recent years in sort of people being more willing to talk about it and being more willing to sort of take the steps to say, I need this?
I think generally speaking, yes. There is more of a willingness for people to either self-identify to say, I need help, and also other people, friends or family, be able to say, I have a family member who needs help. Mm-hmm. People who know that I work in this industry often ask me, how can I help either my friend, my nephew, my niece, my sister, my brother? So people talk about it. Years ago, it was never spoken of.
Yeah.
And so I think we've come a really long way. At the same time, there's a lot of bias that still exists because people make judgments still about the people we serve. The way they look, the way they dress, the way the language they speak, whether they're employed, whether they're not employed, all that kind of stuff. So we still have a long way to go. And I think we each have a responsibility. I'm sure you hear it, I hear it. People make judgments about people.
Sure.
But I think that's our opportunity to say, hey, time out. This is what really could be going on. And so cut them some slack and give them a break.
That said, can people sort of self-refer, self-identify to together and to access them?
Most of the services they can. Many of the services that I spoke about regarding behavioral health and substance use, they can refer themselves. They can call. They can go onto our website and get the information to call. There's some services, because we work with the state, they make the referrals. So, for example, the services for people with intellectual and developmental disabilities, or the services for youth in our youth residential programs, foster care, they usually make the referrals. But the programs like the Family Resource Center, the Recovery Center, substance use, people can call themselves and they can stop in and walk with them and direct them where they need to go.
And what's your website where people can see what you have to offer?
It's www.gandaracenter.org.
Gandaracenter.org.
Yeah.
Looking forward, I know you mentioned the new place at South Hadley. Is there any other news to report that people should be aware of, or events coming up? I know you think you have a 5K this summer.
Yeah, we do our annual 5K. It's a run-walk, so you don't have to run it. I walk it. So it's fun.
I'd be walking if it was me.
It's fun because there are lots of people that come, and people come with their children, their families, their infants, their dogs. So you can walk with your dog. You can stroll your baby in a stroller. You can run with your dog. I've seen people run with their stroller. So it's an exciting event. It is our annual fundraiser. We're holding it at Forest Park this year. So we're very excited to have it in Springfield proper. So that's great. Next year, we celebrate our 50th anniversary. So we'll have some type of signature event. So stay tuned. We are opening up the residential program in South Hadley. And stay tuned because we continue to grow, continue to provide services and new programs.
Just a couple more questions before we close. What would you consider the biggest challenges of running an organization of your size right now?
Yeah, so we're a big agency, and I think it's probably not any different than some of our other colleague agencies. So, for instance, most of our funding comes from the Commonwealth in some way, either through Mass Health or through grants that have been assigned to us.
Sure.
So the state, like any business, has to provide a balanced budget, right? So we have our finger on that pulse and know what are some of the challenges that the state is dealing with, how it may impact us. And we do lots of advocacy when we need to do advocacy. And if there are times where we have to figure out how do we adjust programs in a way that still keeps them continuity, we do that as well. But that's a constant thing that I look at every single day in the seat that I sit in. So some days it's good, sometimes it depends. Ensuring that we have adequate staffing and enough staffing and staffing resources is really important. So that's another key area because staff is our greatest resource. So without staff, we can't provide the services. So I have a great team that is focused on hiring and retaining people.
On a more positive note, what do you find most gratifying about the work you do?
Well, personally, I think about this question a lot, and I've thought about it over the years. And for me personally, I really am grateful that I'm able in some way to make an impact in people's lives. And in all the roles that I've had, in one way or another, I've been able to impact that, whether it's providing direct services or directing a team or leading an organization to provide resources and the space to be able to provide the programs that are needed. That's what I find gratifying is how do I influence that in our community, in our world, in the state? I believe that people have the ability to change behavior. I have a team that believes the same thing, or else we would not be doing the work that we do. And that's what I find most gratifying. So when you hear the stories of people that have gone through our program, that's really heartwarming. We also hire individuals who have gone through some of our programs. For example, we hire recovery coaches who may have gone through our program because they have lived experience, and then they're able to help other people. So those are all positive things.
That's great. I so appreciate you coming on and talking to me today about the important work that you and your team are doing.
Joe, thank you. Thank you for having me today, and thank you for all the good work that Business West has done. It's a great organization, and you have great events.
I really appreciate it.
Thank you.
And thanks to all of you for tuning into BusinessTalk, a podcast presented by Business West and sponsored by Greenfield Cooperative Bank. I'm Joe Bednar, the editor of Business West, and we'll see you next time.